Welcome, everyone. I am Dr. David Pascal, chiropractor at the Pascal Health Institute in Cary, North Carolina. We are excited to be here today because I do have a very important conversation that I've been putting off, but I just can't put it off anymore. I feel that there are too many people out there that are not getting the care that they need, that are delaying getting the correct care that they need, and that creates a whole host of problems. So I'm going to dedicate today's call to talk about all those things. I would first like to start off if you if you're looking for a solution, you're looking for help. What I found is that there's two ways to look for help. You can be looking for a yes, like yes, I'm looking for the right situation, or you're looking for a no. You're looking for a reason not to go someplace. And I can tell you that if you're coming from a place, I understand that everyone's trying to do their due diligence, and you should do your due diligence with CRPS. That's very important. But your your singular approach to that really dictates the outcome. And what I found in my experience of treating patients for over 37 years is that some people are looking for a reason not to start care. And there will always, always, always be a reason not to start care. It's not the right time. I don't have the money. I don't know if this is the right doctor. I have to travel. I can't travel. I want to travel. I don't want to travel. It's the wrong time of year. My kid's in school. My kid's out of school. It's a full moon. I mean, there's always going to be a reason not to do something if you're looking for a reason not to do something. And in lots of things in life, that's fine. It's not going to impact you. Unfortunately, with CRPS, many of the people that contact me don't realize a couple things. They do not realize that CRPS is progressive. That means it gets worse. CRPS doesn't just magically go away. You wake up one morning and go, oh, wow, my CRPS pain's gone. That doesn't happen, never has happened, probably never will happen. That's not what happens with CRPS. What happens with CRPS is you get it in one place, typical thing, someone, breaks a bone in their foot, gets a boot. The pain goes through the roof, right? We all know this. And then it just stays in your foot, right? No, it doesn't just stay in your foot. It gets worse and worse and worse, and then it goes up to the ankle, to the calf, to the knee, to the hip, that full leg. Then it jumps over to the other foot, ankle, calf, leg, right? This can happen in 2 weeks, or it can happen over 2 years, but it's going to happen. Then it's going to go into your arms, and then it's going to go into your body. Many, 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 many countless CRPS patients that I've seen come to me, they have full body, unchartable pain. You cannot touch them. I cannot touch them. It's like you have third-degree burns all over your body. That you can't, it makes care very, very difficult if you can't actually be touched. It makes your quality of life horrendous if you have full body. Just having CRPS in one foot is horrible enough. So I really want to drive this point home is that CRPS, complex regional pain syndrome, is a progressive, debilitating disease. In addition to that, only about 20% of the people that get CRPS will respond to classic Western medicine. You have severe pain, you're going to go to your GP. Your GP is going to send you to a pain clinic or to, once they figure it out, to a pain clinic or a neurologist. And they are going to try to treat you like you have a pain condition. So that means they're going to give you painkillers. They're going to give you drugs that are designed to decrease pain. And if whatever they give you doesn't work, they're going to give you a higher dosage. If that doesn't work, they're going to give you a stronger med. And if that doesn't work, they're going to give you a higher dosage of that. If that doesn't work, they're going to give you an even stronger painkiller. And if that doesn't work, they're going to give you an even higher dosage. And then they may decide to put you into a coma and run drugs through your body for a day or a week or a month in an effort to kill pain. And if that doesn't work, then they're going to try blocking the nerve with injections or electrical currents, or even cutting the nerve either with a knife or with some type of uh, radio frequency device that kind of cauterizes that nerve. They might even try to put spinal cord stimulators in your body, actual operation for complex regional pain syndrome. Only 20%, right at the very beginning, really, for all intent and purpose of this progressive degenerative condition, will get relief. So if you're one of the people that has CRPS, you doctor hop trying to figure it out, finally someone goes, oh yeah, I think you have CRPS, and then they give you, a course of painkillers and one of those works, then you're in the lucky 20%. If that doesn't work, it is extremely highly unlikely that any medical intervention is going to work. That's terrible. That's awful. But that is the fact of CRPS. Go do your due diligence. Go do your research. Go look at people with long-term CRPS. They will all tell you exactly what I'm telling you. You may even already know that yourself. So what happens for me is that people are on their journey and they are looking for solutions, and they come across my office one way or another. They've been referred by another one of our patients or by a doctor, or they stumble upon us on the internet, and then I do a Zoom call and we do an in-depth consultation. And quite often they will tell me that they're not really ready to do something like a totally immersive, in-depth program like I have, or they may say they don't have the time to come, because my typical patient that comes here stays for 3 months, and we see them every day. Some people say they can't block off that much time from their lives. Other people have financial issues, totally understand that, and they say they can't afford the care because all the care that we do isn't recognized by insurance companies, right? If you want a drug, you want surgery, maybe chiropractic, which is about 5% of what I do with my CRPS patients, insurance will cover that within those limits. But outside of that, insurance is not going to cover you. So if you're not, the bottom line is, if you're not in that 20% where you get relief right away from meds, it is going to come out of your pocket ultimately. And unfortunately, when these patients come to me and they say, hey, I want to come, but I don't have the finances, and then they go, I'm going to go search for another avenue. There aren't other avenues. There are literally just a handful of doctors in the country that are consistently helping put patients with CRPS into remission. A lot of those doctors I actually trained and mentored. If you are talking to a chiropractor that does other modalities in addition to their care, in all likelihood, they've been mentored by me or attended some of the classes that I've taught. And so if you think you have time, you're never going to be in a better position than you are right now. Your pain's never going to be lower than it is right now. So if you're waiting for the right time of year or a break or kids out of school, or your finances to change, you're never going to have more energy and more ability to find the time or find the money than you do right now. Think about how debilitating your pain is if it's just in one limb or two limbs, and how that gives you brain fog, brain confusion, makes it difficult to concentrate, makes it difficult to go through your day, because when you're in this much pain, you're burning a lot of mental and physical energy, right? All the CRPS patients that I talk to, they're pretty much exhausted all the time. So once that pain is full body, you've already endured it for another 1, 2, 3, 5 years, you will not be more able then and have more energy and more mental ability or clarity then than you do right now. And we've had so many people recently reach out saying, hey, I'm going to put it off, I'm going to put it off. And that is really why I'm hopping on here today with this Facebook Live to implore you to really look, to really pay attention, to really realize the situation that you're in. You know, I'm not trying to use scare tactics, but I see people with CRPS metaphorically is like Thelma and Louise. You're in a car, you're driving right toward a cliff, and that cliff is not going to disappear. And that car is not going to slow down unless you proactively put your foot on the brake and start buying yourself some time. So if this provokes you, if it upsets you, I'm sorry, maybe it's intentionally trying to make you look and really look at the situation you're in. If you have already talked to me and you want to talk to me some more in light of this conversation, if this is the first time you're hearing me speak and it raises some questions for you, and you want to talk to me, I'm here. This is what I dedicated my life to. This is what I began studying for 50 years ago. 50 years ago, I decided I wanted to be a chiropractor. I wanted to help people to the best of my ability. I've invested over $2 million in my education, in the treatment modalities that I have in this office so that I can help you. But I cannot help you if you don't come see me. I cannot help you if you don't call into my office, schedule a Zoom call, and take that first step with me. I will love to do everything that I can to help you, but the first step for you is to pick up the phone or type into your email that you want to set up a call, and let me share my information, my experience with you. Let me help you find a way to get into my office so that you can get relief. I hope that this has been an enlightening call, a motivating call or talk, and I look forward to helping all the CRPS patients that I can. With that, I wish your journey well, short, and healthful, and look forward to talking to you as soon as possible. Goodbye.